Brought to you by St. Francis Health, serving our community for 111 years.
Welcome back. While groundbreaking treatment for type 1 diabetes is showing promise, Darius Johnson reports.
Here at UChicago Medicine, life-changing transplants are being conducted for type 1 diabetic patients.
This medication has a great potential to be less toxic to the patient and be more beneficial, providing better outcomes in islet transplantation.
That medication is tegoprubart, modified over the last 25 years to help bring positive results for type 1 diabetic patients who use insulin, patients like Marlena Godell.
I have so much more energy. I feel so free.
For 25 years, she has lived with type 1 diabetes.
I would go to sleep at night and think, this might be my last night. I might not wake up and see my daughter ever again.
She says her tipping point was when her daughter found her on the floor after her sugar crashed. She then talked to 3 doctors about islet cell clinical trials and got nowhere until she researched.
I emailed the University of Chicago and essentially just wrote out my entire life story and just saying, please help, I've had enough.
That was last October, and on July 17th, she went in for her procedure.
They just kind of made a very small incision and then injected the islet cells into my liver because, well, my pancreas don't work, so they injected them into the liver.
3 weeks after the procedure, she was off insulin. For that, she thanks trial co-investigator Dr. Peter Wachowski.
Her life was severely compromised, and she couldn't live like this anymore.
Looking forward to helping the other diabetics get their hope back.
3 months later, she's living a life like never before. Darius Johnson, CBS News.